There are a lot of myths and certainly a lot of confusion that surrounds tension type headaches. And that's what we're going to be clearing up today. We're going to be talking about everything to do with tension type headaches, what you can do to get rid of them, and what actually causes them. Hi, I'm Dr. Beth, an osteopath here at Melbourne Headache Solutions. If you're there, say hi, and certainly if you've got any questions at all on the topic, drop them below and I will get back to you. So first and foremost, what actually is a tension type headache? Well, the pain of a tension type headache forms this halo type sensation around the head. So it goes up and around across the forehead, around the sides of the head, and around the base of the skull. Now, you don't need to get it all the way around the head. You can just get it in the forehead, sides of the head, or the back of the head, or any combination thereof. Also, you can get this pressing sensation on the top of your head as well. So any distribution there. It's an achy kind of pain, like a dull ache, and also certainly a pressure or a squeezing sensation. So that's what a tension type headache actually is. So, the first myth that we're talking about. I get a lot of people telling me that everyone gets tension type headaches. They're really common. No, they're not. Not everybody gets tension type headaches. If you actually ask a non-headache sufferer when the last time they got a headache was, the answer is usually, I don't know, or like 3 or 4 months ago. The answer is certainly not once a week, twice a week, 4 times a week, like I often get people saying. That if you're answering that question saying twice, 3 times, 4 times a week, that is not the answer that you're looking for. That means that you are certainly a headache sufferer. Okay? So, that is the first myth that we're busting. Being a tension type headache sufferer is not normal. Okay? You can certainly do something about it and you don't have to live in pain. The name tension type headache is also a bit confusing because it implies that usually like stress is involved or that there's some kind of tension involved. Now, for it to be a tension type headache, you don't have to be stressed. That's usually the first question that people ask. Were you stressed when you got it? Are you a stressed person? And a lot of my patients, they're not. They are quite relaxed people. So it doesn't have to be induced by stress. It certainly can, but it doesn't have to be induced by stress. And the other part of the name, tension, implies that, the muscles around here need to be tense because that's where you're feeling the pain. But no, that's not true either. They actually did a study into it and found that when people were suffering from a tension type headache, the muscles of the forehead and around the temples, they didn't actually increase in tone. Instead, they found that the muscles at the base of your neck, at the base of your skull here, they actually increased in tone. And that's really important because, as I've spoken about before, it is actually the top 3 joints in your neck that are creating these headaches. They are your headache and migraine producing joints. And often tension type headache sufferers experience neck pain or neck tightness in association with their headache pain as well. So, how do we actually get rid of these headaches? Well, normal manual therapy techniques, they just treat neck pain. They're not actually designed for headaches and migraines. So what we've got to do is we've actually got to treat these joints in a way that's specifically designed for headaches and migraines. Because there's an underlying disorder in headaches and migraines which basically keep you in a headache state. So it means that it's very easy to tip you from a non-headache state to a headache state. And this disorder is called brainstem sensitization. So we not only need to treat your neck joints, but we also need to treat this brainstem sensitization in order for anything to change. So we need to treat both pieces of the puzzle, okay, in order for anything to change. So treating your neck and treating this underlying disorder to get those long-term results, which is what we are after, okay? So that's what we're going for. So if you think that your neck is causing your tension type headaches, which it is for most people, then comment survey in the comment section below and we'll send you a quick questionnaire to determine whether your neck is the cause of your headaches. Okay? Wonderful, because we want to see you getting on those long-term results, and the next time we ask you, When was the last time you had a headache? You answer, I don't know. So, beautiful. Comment survey below if you want that survey. Otherwise, I'll catch you next time. Thanks, guys.